Hello, my name is Ashley Neal, and this video is going to show you how to do flexibility assessments. Before any flexibility assessments are performed, the participant should perform a short warm-up, including moderate aerobic activity and flexibility exercises. It is highly recommended that the participant refrains from fast, jerky movements. First flexibility assessment that is going to be performed is the YMCA sit and reach test. Have client remove their shoes. Have client sit with the yardstick between their legs and place a piece of tape on the 15-inch mark line. Client's legs should be extended with heels of the feet on top of the taped line that should be 10 to 12 inches apart. The client should then reach forward with hands on top of each other. One hand should not lead the other one. Client should hold for 2 seconds. 2 trials should be performed, and the furthest point reached by the client should be recorded. The next assessment performed will be the Canadian trunk forward flexion test. For this test, you will need a sit and reach box, also known as a flexometer. You should have clients sit without shoes. Soles of the feet should be flat against the sit and reach box at the 26 centimeter mark. The client's inner edges of the soles should be placed within 2 centimeters of the measuring scale. The participant should slowly reach forward with both hands as far as possible, holding for 2 seconds. You must make sure that the client doesn't lead with one hand. Fingertips can be overlapped, but they should be in contact with the measuring portion of the sit and reach box. The score is the point the client reached furthest with his or her fingertips. Best of 2 trials should be recorded. Ensure that the client is exhaling and dropping his or her head between the arms when reaching. The next assessment that will be demonstrated is the chair sit and reach test. For this assessment, you will need a folding chair that has a seat height of 17 inches, as well as a ruler. This assessment is specific for older individuals greater than 60 years old because many have difficulty performing other flexibility assessments because of functional limitations such as poor range of motion and lower back pain. It also prevents them from getting down and up from the floor. This test also measures lower body flexibility and can be used to assess an individual's ability to get out of a car or chair. Place the folding chair against a wall for stability and have your client sit at the front edge of the seat. Have your client extend the leg that is being tested in front of their hip with their heel on the floor and the ankle dorsiflexed at approximately 90 degrees. With the extended leg as straight as possible and the hands on top of each other, have the client slowly bend forward at the hip joint, keeping the back as straight as possible and the head in normal alignment. The client should reach down the extended leg trying to touch the toes and hold this position for 2 seconds. Place the ruler parallel to your client's lower leg and administer 2 practice trials followed by 2 test trials. When taking score, place the ruler parallel to your client's testing leg and measure from the middle of the big toe to the tip of the client's fingers. Measure to the nearest half inch and record the highest score. If your client cannot pass their toes, it will be recorded as a negative score. The final assessment that will be demonstrated is the straight leg raise test. For this assessment, you will need a goniometer. This test assesses the flexibility of your client's hip extensors, which tilt the pelvis posteriorly. If there is an imbalance in these muscles, it can negatively affect lower back's function. For this assessment, you must make sure that your client lay on the floor with their back completely flat on the floor. The tester will raise the client's leg and ensure the opposing leg is flat and extended on the floor. Place the goniometer on the greater trochanter of the leg. If you have an inclinometer, place it on the tibial tubercle. You will measure the angle of flexion and range of motion for your client. A minimum of 80 degrees is acceptable, an angle of 90 degrees is desirable. Record the angle measured and determine if it is acceptable or unacceptable. The chart above will help you categorize your client. You plug in all the client's information and all the values you got from the YMCA sit and reach test, and it will show you if your client is average or below average. An example of how to plug in your information is shown above. For example, the client used in this video was a male, aged 20 years old, who reached 17 inches, which puts him in the 50th percentile gender of average. The chart above will help you categorize your client for the trunk forward flexion test. You're just going to do the same thing as you did for the YMCA sit and reach. You're going to plug in all your values and classify whether your client is excellent or if he needs improvement. An example of how to do this is shown above. You plug in your values. For example, my client was a male aged 20 years old who reached 39 centimeters. This puts him in a very good category. Above are the charts for the straight leg raise test and the chair sit and reach test. For the straight leg raise test, the client used in this video was 20 years old, and the goniometer measured 70 degrees, which is unacceptable. The chair sit and reach test is used for clients that are aged 60 and above.